A social movement that a lot of us have recently seen in the news with the last election was the idea of voting either for or against a legislation that would mandate Massachusetts hospitals to follow a guideline provided by the government of how many patients a single nurse can have on a single shift. This movement has been promoted and advocated for by nurses throughout the Commonwealth of Massachusetts, especially nurses that are part of the Massachusetts Nurses Association Union. There were many ads on TV, as I'm sure most of us have seen, some promoting to vote yes on one, and on the other hand, there were other advertisements that stated vote no on one. So, as voters, there were many questions left unanswered as to what was right and for how long has this social injustice, as seen by the nurses, been going on, especially voters that are not involved in the medical field at all. Therefore, a lot of people were left with many questions, including which side of this issue should we stand on, and what would it mean for the general population if they or a family member became ill and had to become hospitalized. I think the question lies as, from a nurse's perspective, why do they feel there is a need for limitations on how many patients they are assigned in a given shift? And if this law is not implemented, will all patients still receive their basic right as a human to receive the best possible care in the inpatient setting? I interviewed a registered nurse named Christy Frazier. She has worked in the medical field in a few different hospitals in Massachusetts over the course of 10 years. As a member of the MNA and a clinician now at Tufts Medical Center, she is on the vote yes side of the social movement. I chose Christy because as a nurse who has worked in many different areas of the hospital, including the emergency room, medical surgical inpatient units, and the intensive care unit, I feel as though she would have the most well-rounded perspective of the current needs in the hospital and why she believes we are facing a social injustice by not implementing mandatory patient-nurse limits. She states safe patient limits will ensure quality care for all patients that are in an inpatient hospital facility. She said that if we implement this standard in Massachusetts and there is a safe maximum limit on the number of patients assigned to each nurse at one time, of course with the flexibility based on acuity, then overall patient care will be ever improving. MNA is short for the Massachusetts Nurses Association, which is a union-based organization. The MNA spreads awareness to the public on their website with messages that say, did you know outside of intensive care units, there is no law that specifies how many patients a nurse can safely care for at one time in all other patient care areas? I asked Christy about this claim, and she told me that in fact, nurses are forced by hospital administrators to care for 6 to 8 patients or more at one time. According to a study in the Journal of the American Medical Association, that is double the number that is safe for the patient. The reason in which this raises a concern that there is no rule regulating this, it makes you think about the main reason someone is admitted to the hospital, and that is for round-the-clock nursing care. When you or a loved one are hospitalized, the person most responsible for your care and safety is your registered nurse. At your most vulnerable time, your assigned registered nurse cares for you and keeps you safe while managing your return to health. They have a busy job, which includes many different facets like administering medications, monitoring your vital signs, and always communicating with your family and the doctors and other parts of the interdisciplinary team. Christy explained to me that all other medical procedures or care could be done outpatient. The need to be in the hospital means that you need a nurse taking care of you and you need nursing care. This concept really makes me think of how unjust it would be to not receive the proper care because there were not enough staff nurses. This is just some pictures of some of the rallies that were done across Massachusetts and some of the campaign advertisements that were promoting voting yes and supporting the bill that they would like to be implemented. Unions can be beneficial to fighting for a cause and to achieve fairness while incorporating quality and cost efficiency when faced with a social issue. As we have seen throughout this class, for example, during the labor movement, forming a union was a way to support the cause and protect the workers from unsafe and unfair working conditions. Christy explained to me that the nurses union is no different from that of other unions and that the goal is to achieve the best quality of care to all patients while also providing safe working conditions to all the nurses and to overall protect them as well as the patients. My main question is what else can be done to achieve a social justice to all patients and nurses in Massachusetts regardless of which hospital they decide to receive care from. One idea that Christy had proposed in the interview was the use of an acuity tool. She explained that after the strike that the nurses performed at Tufts Medical Center regarding this very issue of demanding safe patient limits, that she had a meeting with her nurse manager and the idea was proposed to use an acuity tool for every patient on the floor upon admission and then updated on every shift. Each time you click one of the buttons of the assessment, the patient gets classified according to a certain number. The higher the number, the more acute the patient is considered. Therefore, the more time they need with a nurse. Not all hospitals in Massachusetts use a patient acuity tool right now, but if question 1 had gotten approved, all would be required to use this tool. And because this is updated every shift or every time the patient has a change in status, the assignment would be adjusted based on this tool. I thought this was really important because I feel as though even though the bill did not get passed, this acuity tool could be a way for each hospital to implement their own safe patient-nurse ratio limits. And we as nurses might be more open to this idea as a whole. Also, the other message I got from Christy and after researching after our interview was that each person, regardless if they're in healthcare or not, should do their own research. And you should be able to come up with an educated opinion to support either side of this social movement. While conducting this interview, it made me realize that not only does the social injustice lie at the patient-nurse ratio problem, but also the way in which the other side of this issue has campaigned with lies to the general public that were not backed up by evidence, but they were overwhelmingly convincing considering this law did not get passed. The lies by the hospital administration is the other social injustice at hand when exploring this social movement. There were many misconceptions after I conducted this interview that even I, being in healthcare, was unaware of. So I began to ask Christy a series of questions that I think were the most influential on people voting against this bill being implemented. First, I asked her, would implementing this mean that there would be a rigid government-mandated staffing ratio? And because the government would be so involved, would it take vital decision-making abilities away from the bedside nurses? She explained to me that this question was written by bedside nurses like her. Voting yes is the safest thing that we can do for our patients, families, and for the profession of nursing. The next question I asked her was, will this law prevent hospitals from having the flexibility to adjust care based on the specific needs of patients? She said that patients need the level of care and flexibility that will come with having safe patient limits and with staffing the proper amount of nurses. Next, I said, is there any scientific evidence that supports the need for safe patient limits for better outcomes? She explained to me that for decades, independent researchers have published scientific studies supporting the need for safe patient limits, and these are the facts that the people of the MNA and the nurses have used to try to influence hospital administrations of the necessity of this problem. Next, I asked her, one of the most common questions that we've seen throughout all of the advertisements that have been promoting to vote no. And it was that, would implementing this dramatically increase emergency department wait times while delaying services throughout the hospital? She told me that this didn't make any sense. She explained that she has worked in the emergency department and that she knew that wait times usually increase when there are not enough RNs in the emergency department or enough registered nurses on the floors to receive the patients from the emergency room. Lastly, I said, will safe patient limits in implementing this bill result in layoffs of supportive or ancillary staff? She explained to me that throughout her research of being part of this movement, that she looked at other states that have implemented this bill, like California. She said that she has worked with nurses that have also worked in California, and that they explained to her that there were no layoffs of caregivers as a result of California's law. One nurse she worked with specifically said, "We actually saw our numbers grow."